Imagine, for a moment, that you've been whisked back to the Middle Ages. If you think life then was all feasting, jousting, and grand adventures, think again. Simply surviving from one day to the next was an adventure in itself, especially if you ever found yourself in need of a doctor. Or, more likely, a barber. Yes, you read that right. In medieval Europe, the local barber was more than just the person who trimmed your beard. He was the community's multitasker-in-chief, part hairdresser, part surgeon, part dentist, and when the need arose, part pharmacist. Medical science was still in its infancy, and unless you were lucky enough to be born into royalty, your best hope for treatment was the steady hand of the barber surgeon. So what did medical care look like in those days? Let's embark on a journey through some of the strangest, most eyebrow-raising treatments from the Middle Ages. Prepare yourself. Some of these remedies are not for the faint of heart or the weak of stomach. The arrival of gunpowder in the 9th century changed warfare forever, and with it, the nature of battlefield injuries. Before the French barber surgeon Ambroise Paré revolutionized wound care, the standard treatment for gunshot wounds was to pour boiling oil directly onto the injury. The idea was to cauterize the wound and prevent infection. But as you can imagine, the agony was unimaginable. One fateful day in 1537, Paré ran out of oil during a battle. Forced to improvise, he concocted a mixture of egg yolks, rose oil, and turpentine, yes, the paint thinner. To his astonishment, his patients fared much better than those treated with boiling oil. Sometimes, necessity really is the mother of invention. If you think your shampoo has a strange scent, be grateful you weren't around in medieval times. Back then, barbers often used aged human urine as a hair cleanser. Why? Because urine contains ammonia, a natural cleaning and bleaching agent. The Romans had already discovered its power for whitening togas, and medieval barbers believed it could give hair a healthy shine. They even bottled and sold it. Talk about a side hustle. Running low on shaving soap? No problem, just reach for a pint. According to a 1498 document from Oxford University, barbers who couldn't afford soap would use the frothy foam from beer to lather up their clients' faces. It was cheap, effective, and probably made for a rather convivial atmosphere in the barber's chair. Why this never caught on with modern brands like Gillette is anyone's guess. Dental hygiene was a challenge in the Middle Ages, but that didn't stop barbers from offering teeth-whitening services. Their secret weapon? 40s water. A fancy name for highly corrosive nitric acid. It certainly stripped away stains, but it also stripped away tooth enamel, leaving teeth vulnerable to decay and destruction. Sometimes a dazzling smile came at a terrible price. Surgery without anesthesia is a terrifying thought, but medieval barbers had their own solution, the soporific sponge. This was an early attempt at anesthesia, made by soaking a sea sponge in a potent cocktail of opium, hemlock, mandrake, and other ingredients. The dried sponge would be rehydrated and held under the patient's nose, sending them into a deep sleep, or, tragically, sometimes into a deeper slumber from which they never awoke. If you ever complained about the taste of cough syrup, consider this. Medieval doctors sometimes prescribed white Greek, the chalky crust that forms on aging dog droppings. For sore throats and tonsillitis, it was even applied to dissolve tumors. And dog poop wasn't alone. Mouse droppings were used for intestinal worms, and the dung of various animals found its way into all sorts of remedies. Sometimes, the cure really was worse than the disease. Barbers proudly advertised their bloodletting skills by displaying jars of blood in their shop windows. Over time, the blood would coagulate and rot, filling the air with a stench so foul that in 1309, London passed a law banning the practice. The solution? Dumping the blood into the River Thames. The next time you hear the term operating room, remember that medieval surgery was often a public spectacle, with barbers removing kidney stones in front of a live audience to lure in customers. Toothache plagued the ancient Egyptians, thanks to the sand in their bread and poor oral hygiene. Their solution: grinding up a dead rat, making a paste, and applying it to the aching tooth. The remedy persisted through the Middle Ages and even in rural England into the early 20th century before finally falling out of fashion. Sometimes progress is simply the act of discarding old ideas. Not all medieval remedies were as revolting as dog dung or dead rats. For sore throats, coughs, and even burns, people turned to snail jelly. Garden snails were collected, shelled, and mixed with sugar to create a soothing gel. Women also used snail slime to beautify their skin, a practice that, believe it or not, has made a comeback in modern cosmetics. Snail mucin is now a prized ingredient in many beauty creams, thanks to its ability to stimulate collagen and elastin. And if you think the story of medieval medicine ends here, think again. The ingenuity, and sometimes sheer desperation, of our ancestors led to a treasure trove of curious practices. Leeches, for example, were a staple in the medieval medical toolkit, used to balance the humors by drawing blood from patients. This wasn't just a European quirk. Leech therapy was practiced from India to the Middle East, and remarkably, it's made a comeback in modern microsurgery, where leeches help restore blood flow to delicate tissues. Another fascinating fact: medieval hospitals were often run by religious orders, and care was as much about the soul as the body. Patients were treated with prayers, relics, and rituals alongside whatever physical remedies were available. The concept of quarantine, which we now associate with modern pandemics, actually has its roots in the 14th century, when ships suspected of carrying plague were required to wait 40 days, 40 giorni, before docking in Venice. Even the Barber's iconic red and white pole has a story rooted in these medical traditions. The swirling stripes represent blood and bandages, a nod to the barber's dual role as both groomer and healer. Next time you pass a barber shop, you're seeing a living relic of a time when a haircut and a minor surgery could be performed in the same chair. Despite the strangeness of these treatments, they were born from a relentless drive to heal and to understand the mysteries of the human body. Every odd remedy, every risky experiment, was a step, however small or misguided, toward the medical knowledge we have today. The next time you reach for a painkiller or visit a doctor, remember, the path to modern medicine was paved with snail jelly, boiling oil, leeches, and a whole lot of curiosity. History, after all, is not just a record of what we got right, but a chronicle of our boldest attempts to solve the puzzles of life. And who knows, the remedies we take for granted today may seem just as strange to future generations. The adventure of discovery, it seems, is never truly over.